Stop. Before you take another painkiller, listen to this. That bottle in your medicine cabinet? It causes more liver failures than alcohol in America. That extra strength pill you just bought? One glass of wine could destroy your organs. Drug companies know this. Your doctor knows this. But nobody told you. Those labels, they don't tell you everything. I'm about to show you 4 dangerous painkillers and 3 safe options that won't land you in the ER. Look, I get it. Your head hurts, your back aches, your knees throb after that workout. You want relief, fast. So you grab whatever's in your cabinet. Or you buy the brand you recognize, maybe the one on sale. And that's where things go wrong. For millions of Americans, every single year. Want to know something crazy? Americans take 80% of the world's painkillers. 80%. The FDA warns us. Studies show the risks. Doctors see the damage daily. But you never heard about it. Why not? Because that info is buried in medical journals. Hidden in fine print nobody reads. Before we dive in, let me tell you why you should listen to me. I've spent so many years researching pharmaceutical safety and consumer health. I've consulted with pharmacists, reviewed clinical studies, and interviewed patients who've experienced serious side effects. I've dug through the FDA warnings. Read the fine print. Talk to the experts. Today, I'm breaking down that research into advice you can actually use. No medical degree required. 4 dangerous painkiller types. Why doctors don't warn you. 3 safer options, backed by research. How to choose at the pharmacy. In the next few minutes, you'll know more about painkiller safety than 95% of people. This knowledge could save your life, your liver, your heart. Ready? Let's start with the painkillers you need to avoid. Painkiller number 1, combination products. Here's where things get sneaky. See those painkillers labeled PM or migraine or complete? This is type number 1 you need to avoid. Here's why. These pills contain multiple drugs, sometimes 2, sometimes 3, even 4. And here's the problem. You're not tracking all of them. Look at this. Excedrin has 3 different drugs in one pill. Tylenol PM, acetaminophen plus a sleep drug. Advil PM, ibuprofen plus that same sleep drug. Why is this dangerous? 3 reasons. First, your organs work overtime. Your liver processes all these drugs at once. Your kidneys filter everything. It's like making them work triple shifts. Second, you lose track. You take Tylenol PM at night. You wake up with a headache. You take regular Tylenol. Boom. You just double-dosed on acetaminophen. Third, these cost more. You pay extra for convenience. But you could buy each drug separately, for half the price, and be safer. Let me tell you about Sarah. Sarah's 34. She's a teacher. She caught a cold from her classroom. She took cold medicine. It helped with aches and congestion. A few hours later, headache. So she took her regular headache pills. Just 2 tablets. 3 days later, Sarah was in the hospital. Acute liver damage. What happened? Both medicines had acetaminophen. She was taking double the safe dose. The scary part? Sarah was careful. She read instructions. She followed dosages. She did everything right. Except she didn't check if different medicines had the same ingredient. Now here's what drug companies don't tell you. See extra strength on the label? Know what that means? They just added more of the same drug. That's it. Not a better drug. Not a different drug. Just more. And they charge you extra. But here's the problem. Now it's easier to overdose. 2 325 milligram pills equals 650 milligrams. 2 500 milligram pills equals 1,000 milligrams. Take that 3 times a day, you're pushing your liver to the limit. So what's the fix? Simple. 1. Buy single ingredient painkillers. Just acetaminophen, just ibuprofen, not combinations. 2. Keep a list on your phone. Update it every time. Check before taking something new. 3. Read every label, every time. Even brands you know. They change formulas. I know it sounds boring, extra work, but it's less work than recovering from liver failure. Combination products are sneaky, but the next type is even more dangerous. Doctors prescribe it daily. Athletes love it. It's in every medicine cabinet, and it's quietly causing heart attacks. Painkiller number 2, long-term NSAIDs. NSAIDs, non-steroidal anti-inflammatory drugs. That's ibuprofen and naproxen, Advil, Motrin, Aleve. You probably take these all the time. Most people do. Headaches, muscle pain, cramps. They work great. Used occasionally? They're fine. But millions of Americans take these every single day, for months, years. That's where danger starts. Let me be very clear. Regular NSAID use increases heart attack risk by 20 to 50%. That's not small. That's not might happen to someone else. This could happen to you. Here's what's happening inside you. NSAIDs mess with blood vessels. Blood can't flow smoothly. Blood pressure rises. Over time, this damages your heart, increases clot risk, and it gets worse. These same drugs destroy your stomach lining. Your stomach has a protective layer. NSAIDs break it down. Over weeks and months, ulcers form. Bleeding starts. Sometimes severe enough for a blood transfusion. Here's the cruel irony. NSAIDs are painkillers. They mask the stomach pain they're causing. You won't know until it's really bad. Meet John, marathon runner, 42 years old, super healthy, ran 4 times a week. Before every long run, 2 ibuprofen pills. He heard it prevents soreness. He did this for 3 years. One day, John collapsed during a run, dizzy, weak. The ER diagnosis? Severe stomach ulcers, internal bleeding. He needed a blood transfusion. His doctor told him, "This is common among athletes using NSAIDs regularly." John had no idea. He thought he was being smart, taking care of his body. Nobody warned him that ibuprofen before every run was destroying his stomach. Here's something that'll blow your mind. Prescription NSAIDs? Same exact drugs, just prescription strength. The FDA requires a black box warning. That's the strongest warning they give. It says, "Warning, heart and stomach risks." But over-the-counter versions, Advil and Aleve from the pharmacy, same drugs, same risks. Just smaller warnings, tiny print nobody reads. The drug isn't different. The danger isn't different, just the label. Why? The FDA assumes over-the-counter means occasional use. But that's not how people use them. People take ibuprofen daily, for weeks, months, years. Nobody tells them to stop. With alcohol, everyone knows daily drinking is bad. With NSAIDs, people think it's fine because no prescription needed. It's not fine. Wait, before you panic and toss all your Advil, let me be clear. Occasional use? Totally fine. Short periods when you need them? That's what they're for. The danger is long-term, daily use. Especially dangerous, combining with blood thinners, alcohol, if you're over 65. So here's what to do. Stop taking NSAIDs daily unless your doctor said to. If your doctor did say to, ask about the heart risks. Ask about safer options. NSAIDs cause heart attacks and stomach bleeding. That's bad enough. But the next one? Even worse. It's marketed as the safest painkiller. Doctors tell you to take it, and it's the leading cause of liver failure in America. Painkiller number 3, acetaminophen. Overuse. Acetaminophen, that's Tylenol. It's also in hundreds of other medicines. Cold meds, flu meds, sleep aids, prescription painkillers. Here's what most people don't know. Acetaminophen is the #1 cause of liver failure in the United States. Not alcohol, not illegal drugs. Acetaminophen, a drug you can buy at any gas station. Marketed as safe. Doctors recommend it for kids. How is this possible? Here's the terrifying truth. Maximum safe dose? 4,000 milligrams. That's 8 extra-strength pills. Dose that causes liver damage? 5,000 milligrams. Only 25% higher than safe. Compare that to ibuprofen. To overdose on ibuprofen, you'd need 20 times the normal dose. With acetaminophen, the margin is tiny. One extra pill a few times? Danger zone. Here's where it gets really dangerous. If you drink alcohol, acetaminophen becomes way more toxic. Even moderate drinking, 1 or 2 drinks daily, makes acetaminophen harder on your liver. Why? Your liver processes both. When busy with alcohol, it can't handle acetaminophen properly. Acetaminophen builds up. Toxic byproducts form. Liver cells die. Meet Emily, 41-year-old accountant. Chronic back pain from desk work. She took 2 extra-strength Tylenol 3 times daily. That's the maximum on the bottle. She also enjoyed wine with dinner. 1 glass most nights, 2 on weekends. After 6 months, Emily felt tired constantly, a little sick. She figured it was stress. Then her skin turned yellow. At the doctor, she'd lost 60% of liver function. 60%. She wasn't taking more than the bottle said. She wasn't an alcoholic. She followed instructions, but nobody told her that combining acetaminophen with even moderate alcohol destroys your liver. She had no idea. Watch a Tylenol commercial. What do they say? Safe and effective. Gentle on stomach. The brand doctors recommend. What they don't tell you. The safe dose is only 25% below the level that destroys your liver. So what should you do? Never exceed 3,000 milligrams daily. That's a safer margin. Track all products with acetaminophen. No alcohol if you're taking it. Always check cold and flu medicine labels. Ask your doctor about alternatives. Acetaminophen destroys livers silently. That's terrifying. But there's one more type of painkiller that's even more dangerous. Painkiller number 4. Prescription opioid combinations. Prescription opioid combinations. Percocet, Vicodin, Norco. These combine an addictive opioid with acetaminophen. 2 problems in 1 pill. Problem 1. The opioid is addictive, even when prescribed. Even when taken correctly. Your body builds tolerance. You need more for the same relief. Before you know it, you're dependent. This is how the opioid epidemic started. Prescribed painkillers after surgery, after injuries, for chronic pain. People getting hooked. Problem 2? These also contain acetaminophen. Multiple times a day, you're loading up. Add any other acetaminophen product? Overdose territory. Cruel irony. The opioid masks the pain from the liver damage. You feel fine, until your liver is seriously damaged. If you've been prescribed these, take exactly as prescribed. No more. No alcohol. Not even a little. No other acetaminophen products. Ask your doctor how long you'll be on this. These are for short-term use only. If you want more than prescribed, or feel you can't function without it, talk to your doctor immediately. That's a warning sign. But they're your last resort, not first choice. 4 types of dangerous painkillers. Liver damage, heart attacks, addiction. You're probably thinking, so what can I take? 3 types that work without these nightmare side effects. The 3 painkillers you should buy. Safe option number 1. Targeted NSAIDs, used correctly. Remember how NSAIDs are dangerous long-term? Still true, but NSAIDs aren't evil. They're actually really good at reducing pain and inflammation. The key is using them smarter, not stronger. Safe option 1 is NSAIDs, but used right. 3 things matter. How often you use them. What dose? What formulation? Get these right? Safe pain management. Let's start with low-dose aspirin. This is 81 milligrams, sometimes called baby aspirin. This isn't for headaches. It's for heart protection. If your doctor says you're at risk for heart attack or stroke, this helps. It keeps blood from clotting too easily. Next, naproxen sodium. That's Aleve. Daily use is dangerous, right? Still true. But intermittent use, smart use, different. But research shows intermittent use provides same relief for most pain types. You don't build up a reserve. Each dose works independently. You don't need it daily, just when you actually need it. Now, newer options safer for your stomach. First, enteric-coated aspirin. Brand name Ecotrin. Regular aspirin with special coating. Protects your stomach. Doesn't irritate stomach lining as much. Second, Advil Dual Action. Combines ibuprofen and acetaminophen at lower doses. Less stomach stress from ibuprofen. Less liver risk from acetaminophen. Your action plan for safe NSAID use. Those options still involve pills going through your whole body. Safe option number 2. Topical treatments. This is where things get really interesting. When you swallow a pill, here's what happens. Down to stomach, into bloodstream, through liver, filtered by kidneys, circulates everywhere. But topical medications work differently. Apply directly to skin over painful area. Absorbs through skin. Goes right to muscles, joints, tissues underneath. Almost none enters bloodstream. Stays local. Let me show you the best options. First, Voltaren Gel. Active ingredient is diclofenac. This is prescription-strength NSAID, but topical. Just became over-the-counter a few years ago. Works incredibly well for joint pain, arthritis, knee pain, sore muscles. Next, Aspercreme with lidocaine. Lidocaine is a numbing agent. Blocks pain signals in nerves right where you apply it. Third, Biofreeze. Uses menthol. Creates cooling sensation that overrides pain signals. Athletes use this constantly. Fourth, Salonpas patches. Adhesive patches. Stick to skin. Slowly release pain medication over hours. Great for continuous relief. So why don't more people use them? 2 reasons. Reason 1, drug companies barely advertise them. Why? A tube costs $15, lasts 2 to 3 months. Oral painkillers? People spend $15 every couple weeks. Follow the money. Which product do you think they push? Reason 2, people don't think topicals work as well. Swallowing pill feels more real, more medical, more powerful. Rubbing cream feels less serious, like grandma's suggestion. How to use topicals. Apply 2 to 3 times daily to affected area, results in 30 to 60 minutes. For acute pain, pulled muscle, tweaked knee, reach for topical first. Apply 2 to 3 times daily. Results in 30 to 60 minutes. Now, topicals are great for acute pain. But what about chronic issues? What if you have ongoing inflammation? Arthritis? Joint pain that never really goes away? That's where option 3 comes in. Safe option number 3. Natural anti-inflammatories. These aren't traditional painkillers. Don't block pain signals. They reduce inflammation in your body. Less inflammation equals less pain. First, omega-3 fatty acids, EPA and DHA specifically, from fish oil supplements. Brand recommendation: Nordic Naturals Ultimate Omega. Omega-3s reduce inflammation throughout body, not just one spot, everywhere. Second, turmeric, specifically curcumin with black pepper extract. Brand: Kunal Turmeric. Black pepper extract, piperine, helps your body absorb curcumin. Curcumin is powerful anti-inflammatory. Research shows it reduces pain and stiffness in arthritis. Here's your complete pain management strategy. For acute pain, sudden injury. Step 1, topical treatment, Voltaren Biofreeze. Step 2, if not enough, short-term oral NSAID, 2 to 3 days max. For chronic pain, ongoing arthritis. Step 1, start omega-3s plus turmeric daily. Step 2, add topical treatment as needed. Step 3, Intermittent NSAIDs only if necessary, 2 to 3 days per month. All right, we've covered a lot. 4 to avoid 1. Combination products 2. Long-term NSAIDs 3. Acetaminophen overuse 4. Opioid combinations. 3 to buy 1. Targeted NSAIDs, smart use. 2. Topical treatments 3. Natural anti-inflammatories. 4 types to avoid. 3 safer alternatives. But information doesn't help if you don't use it. Let me give you a simple action plan. Start today. Step 1. Audit your medicine cabinet. Go to your bathroom. Check every painkiller. Look for combination products. Anything saying PM, migraine, complete, extra strength. Check expiration dates. Expired? Toss it. Don't throw them in trash. Take to pharmacy drop-off. Step 2. Talk to your pharmacist. Next time you buy painkillers, ask, which option has lowest risk for my situation? Tell them what other medications you take. Step 3. Start a pain journal. Track when you take painkillers and why. You might discover patterns. Prevent the pain. Skip the painkiller. If this helped you, hit that like and subscribe button. Drop a comment. Which painkiller surprised you most? You made it to the end. Now take action. Check your cabinet today. Read labels. Make smarter choices. Your body is counting on you.